There are many myths about addiction treatment in general, and I'll probably start off with alcohol treatment. One of the biggest myths of treatment or concept is you need to be completely abstinent to get better. That is not true. It is important to realize that a great many people on this planet actually drink socially. And they are not addicts of any kind, and they do not have alcohol use disorder. What that means is that if you can get people back to a level where you are reducing the harmful effects of drinking, and they are drinking at a normative level, which is safer for them, then you will be able to return these individuals at least to their families, to a job, to their community. One of the most important things, I believe, of addiction treatment is you've got to let people take back hold of their lives, which is what they've lost. And getting them into a cycle, a destructive cycle of failure, is not helpful. One of the things that I realized is that most people who come into contact with addicts are not addiction specialists. In fact, very few of them are indeed. And so the real training needs to be at the level of the general practitioner, but also other allied services, the police force, the firemen, the nurse, the pharmacist. All of these individuals have actually a greater amount of contact with individuals with addiction than most addiction specialists in the United States. And those people need to be trained. We do have really good treatments now that people are not availing themselves of. And those treatments are better validated in my view. They are better modulated because you're able to look at how a patient is done and follow them up. And they're done by individuals who are actually trained in treating the disorder. The Lancet published an article about a year ago now showing that alcohol use disorder was the highest cause of morbidity and mortality in individuals between 19 and 51. So now you have an important and very serious brain disease. Wouldn't it be better that you go and see someone who actually is trained in treating brain diseases? If you had a cancer, wouldn't you go to a cancer specialist? Or would you rather go and talk with someone else who has cancer? If you had heart disease, would you rather go to a heart specialist or spend your time talking with somebody who has heart disease? So it's important to have support, but it is also important to have precise and directed treatment towards the disorder that you have. I had a very interesting conversation with somebody who had started off a boutique clinic in West Palm Beach. And I think you should come by and see what we do and determine whether you might like to become involved. So I said, do you have some kind of certification for this new clinic? He said, well, I'm sure we do, but I have to ask my assistant what the certification is. But really, it's a great facility. We have some swimming, we have some horse riding, and we also have a lot of sightseeing, and we have incredible rooms. You could come here and you could be in this rehab. And I said, well, do you offer any treatments? He said, oh yes, we have some groups and we have treatments, but we know that 90% of these people are going to come back. So why would this is all we have. And I said, 90% of the people are going to come back. So he said, oh, it may even be more than that. He said, 95% of the people are going to come back. I said, that's really terrible. And he said, and I said, well, what do you offer the 95% of the people who come back? He said, oh, the very same thing. They check in, they enjoy the facilities, they go away. And I said, by the way, are you an addiction specialist? He said, no, I'm not an addiction specialist. I said, are you a doctor? So I said, yes, I'm a doctor. And I said, what kind of a doctor? He said, oh, I'm a neurosurgeon. I said, do you actually have any training in addiction? He said, no, I have no training in addiction whatsoever. I said, does anybody in your clinic have any training in addiction? Well, I've got a few people who've gone to various groups and they've had addiction themselves, and they look after the individuals. By the way, would you like to come by and see my facility? And my answer was, thanks so much for the call, but absolutely not. So because that type of clinic is everything I'm against. And I couldn't possibly come to a facility as a responsible physician where I'm being told 95% of the people who come there do not get better, and they keep coming back, and there's no hope or no treatment for them. I don't want to be seen around there. This seems to be a repeated theme in a lot of rehabilitation centers. And I did a program with Sanjay Gupta several years ago on the growth of this industry, and it's really pretty sad. And the sadness that I have is if you had a mother today, a father today, a brother today, who unfortunately has somebody who has an addiction, there is no resource. Who do you call? There's no yellow pages, there's no guideline, there's no standard of care guideline, you're really on your own. The other question, which I think is important to talk about, is really the stigma of addiction and how powerful it is. And unfortunately, a lot of people die of this stigma. And I thought, being somebody who, I think I come from a really well-educated family, would never be the victim of this stigma. It couldn't possibly happen in my own family. About 10 years ago, I received a call in the middle of the night. And it was my sister on the phone, and she said to me, "Do you know your cousin died?" And I said, "Gosh, he's young. He's only 40 years old. How could he die? I was in a car accident." And she said to me, "Gosh, I'm sorry to tell you this, but he died of liver cirrhosis due to alcohol use disorder." I said, "What? He died of what? He died of alcohol use disorder? Why didn't anyone tell me he was ill? I mostly grew up with him. No one told me he was ill. I see him 3 or 4 times a year." She said, well, it was like this. And I really tried to get them to talk to you. But what happened to him was every time you were around and he was drinking, there was a plan to make sure you didn't see him drinking, to make sure you didn't see him intoxicated. And there was somebody there to divert your attention, so you never noticed he was drinking so much. And that was like a sword through my heart. And I felt that like somebody who had been almost implicated in something that was so horrible, and I couldn't help a member of my own family. And I was driven to tears, I was driven to distress, because I thought to myself, if I was a leading heart surgeon and I had a family member with heart disease, I'd be the first one to call. If I was someone who was a breast cancer expert and one of the ladies in my family had breast cancer, I'd be the first one to call. But because it was addiction, not only would no one tell me, they hid it from me. So how is it possible for when this can happen to me, for me not to understand the real pain other people feel, the real pain of stigma? And I think a lot of people do not appreciate how powerful stigma is and how demoralizing it is for the individual. And here it was right in front of me, and I had a lecture that day, and I went to my class and I said to my students, I told them the story, and I said, this is de-skilling. It takes all the skills I have away. I can't help people I really want to help. But I've obviously had more to thinking through that, and it's now, to my mind, the most powerful message is to make sure that as much as I can, people realize that this is a medical disease. There are treatments. It is treatable. There are possibilities. Now, doctors aren't God. We can't treat everything. We can't cure everybody. But there is real hope, and there are really good treatments. And I really want people to know that and to try and find those treatments for themselves, for their families, for their community. How would we have the rehab industry change? I would like any industry that treats one of the most severe diseases on this planet to have some kind of standard of care and some kind of metric. And that standard of care and those metrics need to be regulated. It's really important because we have no regulation whatsoever. It's very hard to determine unless there has been an egregious behavior by a doctor, almost criminal, to be able to feel that the person didn't get adequate treatment. And it shouldn't really be that extreme. We have enough ways to be able to measure whether somebody's getting better or healthier, and those should be implemented, and those statistics should be published. And I'd be very, very happy to publish our statistics from our institute and compare them with anybody else in the United States or around the world. It should all be open information that people can have access to make informed decisions. We do know a tremendous amount about the addiction disease. People just don't have access to treatment, or they haven't heard about the right treatment. And one of the most important things is to educate people about the possibility of treatment. We're now entering what I would call the age in which we know a lot about addiction. And my hope is that by the time my young kid is a doctor, that doctors are properly trained and health workers are trained in addiction. I had probably a week and a half of training in addiction as a doctor, and I always tell and not to put a fine point on this, that I learned about so many esoteric diseases for weeks that I've never really seen a patient with these kinds of diseases. And yet, some of the most common and most damaging diseases on this planet, we teach so little about in nursing school, in medical school, in pharmacy school, and really that needs to change.